Do you wake up with extra crusty, uncomfortable eyelids? Do you constantly have that dry, itchy, gritty feeling even after using all the right eye drops? Most people don't realize this, but tiny, invisible critters might be living on your eyelashes. They're called Demodex mites, and they're way more common than you think, and they could kind of get really out of control. So let's get into it. Hey everyone, I'm Dr. C, Double Board-Certified Optometrist and the owner of Eye Drop Shop. Welcome back to the channel, where I explain complex eye issues simply, giving you the knowledge and science-backed tools to empower you to start feeling your best quickly. Full disclosure, I'll link a few products in the description below that can help control Demodex on your eyelids. None of this is sponsored. My goal is simply to share options you can discuss with your doctor to help you start feeling better faster. Today we're talking about something called Demodex blepharitis and what you can do about it. Because if you've been treating your dry eyes with drops and nothing seems to help, there might actually be an overpopulation of tiny mites making your lashes their home. If you're all about keeping your eyes healthy, comfortable, and looking their best, make sure to hit that like button, subscribe, and ring the bell so you don't miss any of our future episodes. All right, let's jump in. What is Demodex blepharitis? Demodex are microscopic mites that live on human skin. Most of us have them, they're part of our normal skin, and that's totally fine. But when there's too many, especially around the eyelashes, they cause inflammation and irritation along the eyelid margin. And that's what we call Demodex blepharitis. Now there are two species, Demodex folliculorum, which lives in the lash follicle, and Demodex brevis, which goes deeper into the oil glands. When they overgrow, they clog those glands and trigger inflammation. It's kind of like when your pores get clogged with oil and bacteria on your skin. A few are normal, but too many will lead to irritation and breakouts. Same thing, just happening along your lash line. How does this link to dry eye? Along the edge of our eyelids are the meibomian glands. These glands produce the oily layer of the tears, so the part that's keeping them from evaporating off the surface of your eye. When these glands get blocked or inflamed by Demodex, the oil can't flow properly, and that means your tears evaporate quicker. Your eyes feel dry, irritated, and tired, no matter how many drops you use. So if you're stuck in this vicious cycle of constant dryness, this could be the missing piece. When too many mites pile up on the lashes, they cause irritation, and those loose particles can drop onto the surface of the eye, making things even more uncomfortable. Here are the signs and symptoms that you should look out for. Crusty eyelids or sticky lashes in the morning. White sleeve-like flakes around your lashes. Those are actually called collarettes, and they're classic for Demodex. Itchy eyelids, redness along the lashes, watery eyes that still feel dry, and sometimes even lashes falling out or growing in all kinds of different directions. If this sounds familiar, you are definitely not alone, especially if you have rosacea, oily skin, or you're over 50. Now, why is this often missed? Here's the problem. Demodex blepharitis often goes unnoticed because it just looks like regular blepharitis or dry eye. So people will try to wash their eyelids more often with their face wash, but that doesn't actually kill the Demodex. Even patients who are amazing with their lid hygiene can still have irritation if these mites are part of the picture. When I examine patients under the slit lamp, I can actually see those teeny tiny collarettes, and that is the telltale sign. So if your dry eyes seem to never improve, it's really worth getting your eyelids checked and make sure that this is not the root cause. What can you do today? Step 1. Commit to lid hygiene. Use a dedicated lid cleanser, definitely not baby shampoo, and look for one that contains mild tea tree oil or okra, which really helps control Demodex. Or if you have sensitive skin, hypochlorous spray is really a game changer. I'll link a few options in the descriptions below. If you wear makeup, remove it completely every night and definitely clean your brushes often. Step 2. Warm compresses and blinking exercises. Apply a warm compress for 10 minutes each day to melt those blocked oil glands. Then you're going to want to do blinking exercises to get the oil flowing. If you want to see a video on blinking exercises, let me know in the comments below. Step 3. Professional treatments. If it's more severe, your optometrist may suggest in-office options, which are deep lid cleansing, either new prescription therapies or treatments designed specifically for Demodex. Remember, drops alone won't fix this if it's really the underlying problem, so it's always best to get checked. Who's at risk and what can we do to prevent it? Demodex blepharitis is most common in people over 50 years old, in patients with rosacea, and in those with oily or acne-prone skin. The best prevention is consistency. Daily lid hygiene, changing your pillowcase often, replacing your mascara and any other makeup products that goes near your eyes very frequently. Also just having healthy skincare habits. And of course, regular eye exams, because this is where we're going to diagnose what is truly going on and the underlying cause of your dry eye. So if your eyes feel gritty, your lashes look crusty, or your drops just don't seem to help, check your lash line. Those tiny little white sleeves could be the clue that Demodex is really your underlying root issue. But with proper lid hygiene, eye compresses, and professional treatments, you can get it under control and feel your best every day. If you found this helpful, don't forget to like, subscribe, and ring the bell so you don't miss what's coming next. In the next video, I'll be diving deep into meibomian gland dysfunction, one of the leading causes of dry eye disease. And we'll talk about what you can do to get those glands under control and working again. You won't want to miss this. Thanks for watching, and I'll see you in the next one.